we hear about testicular cancer. It's not an old man's disease. It's sometimes an adolescent or a young man's disease. Is that true?
That's true.
So when should a man, women check their breast at a young age. When should a man or an adolescent start checking the testicles?
Right after puberty.
Okay. What would be an indicator if they felt the testicle area that there could be a possibility that you got to have maybe concern about something like a prostate? I mean, testicular cancer.
It's an unexplained growth of the testicle. Uneven feeling of the testicle. The testicle got bigger. All of a sudden. And it doesn't hurt.
So at that point, you go to see a doctor. If you get to a doctor
you go to your pediatrician, because most of these kids are going to go to your pediatrician. So
if he sees it, it's enlarging, he sends it to a urologist pretty quick.
You can send them immediately for a sonogram and a Doppler study of that testicle.
And if they find
that the testicle has lumps or bumps in there, with multiple like mud ball appearances, with an uneven texture of the testicle, that's a tumor.
And how do we handle that?
Then after that thing, what you do is you draw a blood test and you do something which is called the tumor markers. And remember that the younger the age at diagnosis, the more aggressive the tumor it is. If you find a kid with 14, 15 years old and they develop a testicular tumor, it's usually a bad tumor. When it happens over the age of 25, it's usually less aggressive. Then after the age of 35, it usually gives you a breather. It's not common. You don't get those things. And then it gives you a breather until about the age of 45. Between 35 and 45, usually there is not testicular tumor. It doesn't mean nothing in medicine is either 100% or 0. It means that this is usually the thing. Now, after the age of 45, usually you get the adult type of seminomas, which is a resurgence of the seminomas that happen between the age of 25 and 35. They're usually not so aggressive, but they also have to be taken care of. Now, one of the things that we have to remember also is that about some of the people over there that they come with testicular tumors, about 25% of these people, they started with epididymocarditis with an infection. So when you see an infection in the testicle, you treat it with the antibiotics. Don't forget that you have to do a sonogram of that testicle. Make sure that there is nothing underlying over there that caused this thing.
What's the prognosis?
Depends on which tumor you have. If you have one of those bad diseases, then basically you have to do a big operation, like removal of the testicle, retroperitoneal node dissection. You got to treat them with chemo, you got to treat them with radiation. If you do a seminoma, it's usually very good prognosis. I mean, you just treat them with radiation and removal of testicle, and they do nothing. They do very well with a good normal life expectancy.
So in other words, early diagnosis usually gives you better results.
Very important. A testicular tumor, once you make a diagnosis, you take it out the same day.
So boys should feel his testicles.
They should feel their testicles.
If they're getting large, or one in particular, pretty quick.
Go to your doctor immediately.
Have it checked out.
I mean, you may have a hydrocele. I mean, a lot of swelling of one side of the scrotum is not a testicular tumor. It's usually a hydrocele. And a hydrocele in the kidney is usually associated with hernia. So it's not a tumor. But a lot of times, you may find a tumor. You may find a lump that is non-painful, and it's irregular, and it's usually a tumor in there.